The FDA approved Sotyktu, deucravacitinib, for adults with active psoriatic arthritis, PsA. PsA is a chronic disease with multiple musculoskeletal and skin manifestations. Up to 30% of patients with psoriasis go on to develop PsA. Deucravacitinib is the first and only oral TYK2 inhibitor approved for this indication. This FDA approval is based on positive results from the pivotal POETIC PsA-1 and POETIC PsA-2 trials. In both trials, treatment with deucravacitinib resulted in significant improvement in disease activity, as measured by American College of Rheumatology, ACR, 20 and minimal disease activity response. Deucravacitinib binds strongly to TYK2's regulatory domain, inhibiting allosteric signaling of interleukin-23, -12, and type 1 interferons, which are major cytokines involved in the pathogenesis of plaque psoriasis and psoriatic. The FDA approved ACWI, difamilast, a nonsteroidal topical PDE4 inhibitor, for the mild to moderate atopic dermatitis, eczema. Mechanistically, PDE4 inhibition increases CAMP and modulates downstream cytokine production. Unlike corticosteroids, which remain first-line for flares but carry well-recognized risks such as skin atrophy and telangiectasia with prolonged use, difamilast offers a non-steroidal alternative. This is particularly relevant in pediatric populations and in sensitive areas such as the face or intertriginous zones, where clinicians and caregivers often express concern. The FDA approval was supported by multiple clinical trials, with a significantly greater proportion of patients treated with difamilast 1% achieved clear or almost clear skin with at least a 2-point improvement after 4 weeks compared with vehicle.
The late-breaking results from the RESOLVE-AD Phase 2b trial mark a potentially important step forward. According to the data, respigaldesleukin, an engineered interleukin-2, achieved significant improvements in skin inflammation and itching for patients with moderate to severe atopic dermatitis, while at the same time improving asthma symptoms in those with dual diagnoses. Atopic dermatitis and asthma represent substantial global burdens. Atopic dermatitis affects more than 200 million people worldwide, while asthma remains one of the leading chronic illnesses across all age groups, contributing to more than 250,000 deaths annually. In this context, the dual-acting nature of this therapy is particularly notable. Few treatments show efficacy across both dermatologic and respiratory inflammatory pathways, which often coexist but are managed independently.
Peanut allergy is the most prevalent food allergy in kids under 18 and the third most common food allergy in adults. DBV Technologies said on December 16, 2025, that Bates, its Phase 3 research of the safety and effectiveness of the Viaskin's peanut patch for treating peanut-allergic children ages 4 to 7 exceeded its main goal. Viaskin uses epicutaneous immunotherapy to send small amounts of peanut protein via the skin to make the immune system less sensitive over time. The trial had a statistically significant treatment impact, with 46.6% of children in the Viaskin peanut group satisfying the treatment responder criteria after 12 months, compared to 14.8% of children in the placebo group. DBV is making progress on its ambitions to send in an FDA biologics license application in the first half of 2026. On December 16, 2025, the FDA approved Extensor, depemokimab, as an add-on maintenance treatment of severe asthma with an eosinophilic phenotype in patients aged 12 years and older. It is the first and only ultra-long-acting biologic that can be taken twice a year for asthma. The approval was based on SWIFT trials that showed therapy led to a 58% and 48% drop in annualized asthma attacks over 52 weeks in SWIFT-1 and SWIFT-2 trials. SWIFT data also showed a 72% drop in clinically significant exacerbations that needed hospitalization or visits to the emergency department. About 2 million Americans have severe asthma, and biologics have shown to be helpful in managing severe asthma, but only 20% of eligible people in the U.S. now get one.
Novartis delivered what many are calling a historic milestone for patients with Sjogren's disease. The company announced that its investigational therapy ianalumab had successfully met both primary endpoints in the Phase 3 Neptunus-1 and Neptunus-2 trials, marking the first-ever late-stage success in this notoriously difficult-to-treat condition. Sjogren's disease, characterized by chronic dryness, fatigue, and systemic inflammation, has long been one of medicine's great unmet challenges. Ianalumab is a fully human monoclonal antibody with a novel dual mechanism of action that depletes B cells and also inhibits their activation and survival via BAFF receptor blockade. The Phase 3 results showed not only a statistically significant reduction in disease activity, as measured by the ESSDAI score, but also meaningful improvements in patient-reported symptom burden, captured through the ESSPRI index. Roche announced FDA approval of Gazyva, also known as obinutuzumab, for the treatment of lupus nephritis. This represents a groundbreaking expansion for a drug originally developed to treat certain types of blood cancers, including chronic lymphocytic leukemia. In the Phase 3 Regency trial, nearly half of the participants, 46.4%, on Gazyva/Gazivaro in combination with standard therapy achieved a complete renal response, CR, compared to 33.1% on standard therapy alone. This was accompanied by clinically meaningful improvements in complement levels and reductions in anti-dsDNA, corticosteroid use, and proteinuria, all signaling improved disease control. Until recently, treatment options of lupus nephritis were limited mainly to corticosteroids, immunosuppressants.
Johnson & Johnson unveiled encouraging one-year data from its iconic total Phase 3 study of icotrokinra, a first-in-class oral peptide that selectively blocks the IL-23 receptor. Icotrokinra binds with ultra-high precision, single-digit picomolar affinity, to the IL-23 receptor, silencing a key driver of the inflammatory cascade in psoriasis. Presented at the 2025 Fall Clinical Dermatology Conference, the new 52-week data showed impressive durability. 67% of patients achieved clear or almost clear skin by week 52.44% reached completely clear skin. In patients with a difficult-to-treat hand and foot variants, clearance rates rose from 42% at week 16 to 62% at week 52, an especially hopeful sign for those living with physically and emotionally demanding disease burdens. The FDA has granted approval to Tezspire, tezepelumab echo, a product of Amgen and AstraZeneca, for the treatment of chronic rhinosinusitis with nasal polyps, or CRSWNP. This is an expansion of the drug's initial approval for severe asthma. People living with CRSWNP commonly experience airflow obstruction and symptoms including congestion and an impaired sense of smell. For many patients, current therapies such as systemic and intranasal corticosteroids and repeated sinus surgeries do not offer lasting relief. Tezspire is a first-in-class thymic stromal lymphopoietin (TSLP) blocker. By blocking TSLP, tezepelumab is designed to prevent the release of multiple downstream pro-inflammatory cytokines, offering a broad anti-inflammatory effect.